Michael Harrogate's Wellness Wednesday with O'Connor Chiropractic, optimising the health potential of every family through chiropractic care.
We're back with Dr. Jason from O'Connor Chiropractic, the Family Wellness Centre on Station Parade in Harrogate. And this week, Jason, understanding HRV, so what your heart rate says about your stress and health. Just tell us a little bit more.
HRV, heart rate variability, it's something that's been used for a little while now, but I think it's now being better understood, more widely used. I've mentioned for a lot of people have got these things on their wrists. I've got a whoop on, as say Fitbits, other things, and they're measuring that. And in the clinic, we've actually got a much more high-tech version of that. So it's the same technology as a lie detector test. So you actually put your hand in, it's got 3 sensors. It's looking at your heart rhythms, your skin temperature, and your sweat production. Now, don't worry, it's non-invasive. We don't ask you any questions as well. We're looking at someone's baseline, so we measure it over 5 minutes. And then from that, we actually get a detailed analysis and graph of what's going on in terms of how their heart's performing. And that information can tell us whether their body is in a fatigue state. So let's say they've been under a high level of stress for a long period of time. We get something called overproduction of cortisol, adrenal fatigue, insulin resistance. So this is all linked in with that. And it has connection to things like heart disease, cancer, autoimmune disorders when it's in this fatigue state for a long period of time. So by looking at that, we can actually look at the patient's prognosis and how well they're going to recover and how long that's going to take.
Out of all the tests that you run, is this number one that gives you a real good idea?
I wouldn't say it's number one, but it's a really important part of the piece of the puzzle to help us understand where that patient's at in terms of their health and then giving them realistic expectations. Because let's say they were in the garden, they picked someone at the back went, and now they're really struggling, the back's in spasm. They're not going to relate their heart rate variability to that incident. But by looking at that, you're going to have people that will come in with that kind of injury and you'll adjust them. And within a matter of days, they've recovered and they can go back garden and go back doing things. Whereas you can have another person who could do exactly the same thing, but it actually takes them a month to recover or even 2 months. And the reason being is their body is that fatigued. So their capacity for load is so low. So they're kind of running on empty. And then that was the final straw. But by doing that test, we can understand where they are in terms of their health and give them realistic expectations of how long it's going to take them to recover and also what they need to do to help shift their body back to a healthier, balanced state where they can cope and adapt to stress. Because that's what health is. Health isn't how you feel. Health is the body's ability to adapt to stress. And
you mentioned there as well, going through those different things that people can do, those different actions that an individual can take. And I always think it's important to note that actually, because it's not a simple case of coming in, getting adjusted, ta-da, I'm better. You and the team are there. It is that wellness journey, isn't it?
Yeah, one of the most complex things on this planet is the human body. We're physical, emotional, chemical beings. We're not a car. So we'd love to think, oh, I've just pulls from it, I've just slips from it and it just needs popping back in. It's usually not the case. It's usually a fact that they've been in an adaptive stress state for a long time and now one thing can be the final straw, but actually in reality they really need to make some big changes. But that's what we're here for, is we're here for that long-term health. If you want just a quick fix and instant relief, chiropractic is probably not for you. It's certainly the way we practice. But if you really want to get to the root cause of it and have long-term health and get the best out of your body and work towards being your optimum, we're the place to come to.
And what about the other tests that you guys run at the practice, Jason?
Yeah, we do a multitude of tests. I mean, most people, when they come out, they say that's the most detailed physical exam I've ever had. And we also ask a lot of questions beforehand. So that helps guide us with the tests. Lots of different things, neurological, orthopedic. But in terms of the technology we use, we talked about the heart rate variability tests, which you can use literally from a newborn to adults. And then there is also something called a surface EMG, which is an electromyograph. It's a bit like ECGs they go on the heart, but we're scanning the muscles of the spine. So where the muscles are in more contraction, they're out of balance, we're looking for symmetry. And that can give us an idea of how the muscles are working and functioning in the spine. And the other one we do is a thermography scanner, which is an infrared thermal scanner. This kind of rolls up the spine and it's like a really fancy thermometer, so we can really pinpoint exactly on the spine where there's inflammation, which can be an indication of dysfunction, nerve irritation, and also damage going on in the spine.
And important to know as well that not invasive, it doesn't hurt, it's all painless.
Yeah, completely safe, non-invasive, very quick to do, very accurate. And then we can also re-scan, so then we can see exactly the progress the patient's made from the interventions we make.
Your Harrogate's Wellness Wednesday with O'Connor Chiropractic. Book your initial consultation now at o'connorchiro.co.uk.